So I'm Martin Cunnington. I work with Council of Disabled Children, and I also work for the NHS kind of now commissioning support unit, and so I kind of do a range of different projects across the country. Currently providing the coordinator role for the East London Health and Care Partnership vaccine programme, and also coordinating the testing programme as well. So kind of doing two roles at the moment around that. So maybe if we just kind of go around and just do a few introductions. So I've got Karen at the top of my screen.
Is that Karen McGowan?
Yes, sorry.
It's top of my screen, but I thought it was just because it was me and it was alphabetical, so you threw me then. So I'm Karen McGowan, Head of Nursing Quality and Patient Safety in the Staffordshire CCGs. I have sending my portfolio as well as testing and many other things. And we work with two local authorities, Staffordshire and Stoke-on-Trent. So very interesting times at the moment.
Fantastic, welcome. And if I just go to Phil Ogley next.
Yeah, hi, I'm Phil Ogley. I'm a parent carer from Buckinghamshire. And sorry, I don't turn on my camera because I've got actually my son with me because his school was closed down today because of a positive test.
Okay, well, welcome. Good to see you. Good to hear from you. I've got Elaine Balcombe.
Morning, I'm Elaine Balcombe. I'm one of the DfE SEND advisors. I cover Yorkshire and the Humber, and I think I know Martin from my days as a local authority lead when we were a Pathfinder.
Yes, welcome. Good to see you again.
Thank you.
We've got Lawyer Lucy.
Lucy Lawyer, but it's an easy
mistake
to make. That's fun. Lucy Lawyer, I'm the Senior Commissioner Manager for SEND in Cambridgeshire and Peterborough.
Welcome. Got Kimberly Ward.
Hi everyone, Kimberly Ward. I work for Knowsley Council in the North West. I work in the commissioning team as a commissioning and contracts assistant.
Great, thank you very much. We've got Samantha Barron.
Hi, I'm the strategic lead for SEND for Northumberland County Council. I'm also the designated clinical officer for Northumberland CCG.
Welcome, thank you. I got Stuart Brenton Douglas.
Hi there, Stuart Brunton Douglas, Programme Manager in the Education High Needs SEND service at Norfolk County Council.
Great, thank you very much. Robert Levy.
Hi, I'm Rob Levy. I'm actually a consultant paediatrician and DMO for Rochdale. And we're obviously starting looking at database mode, which is why I'm here now.
Great, fantastic, welcome. Got Paul Senior.
Hi, good morning everyone. I'm Paul Senior. I'm the SEND Programme Director, working with the Bedfordshire CCG and Central Bedfordshire Council.
Great, thank you. Got Kathy Felton.
Oh, hi all, I'm Kathy Felton, working in Sussex as a commissioning manager across children's and maternity.
Welcome, thank you. Anthony Webster.
Hi, yeah, Anthony Webster, SEND manager for North Somerset Council.
Great, thank you. And Catherine Searle.
Hello, my name's Catherine Searle. I'm the designated clinical officer for North East Essex and Suffolk CCGs.
Great, thank you. I'm sorry, have I missed anyone?
Hi, my name is Kali Chahal. I'm the DfE Improvement and Interventions Case Lead, and I cover East Midlands Local Authority and some of West Midlands. I work very closely with Kevin Rowland, who is the SEND advisor, and also Pat Tate.
Okay, great, thank you very much. So I'm just going to share my slides, and we will. Oh, sorry, I've got one more.
Oh, hello, I'm Vicky Monkma. I'm designated clinical officer for Waltham Forest in North London.
Great, welcome. Thank you very much. So I'll just.
Hi, and you've got Deborah Ward, SEND manager for NHS England, NHS Improvements in the Midlands area. Nice to meet you. And I'm actually running a task and finish group on data collection from a SEND perspective
from health in the Midlands region. So it will be great to hear what you have to say.
Okay, fantastic, great. So let me just make sure I'm sharing my screen. Right, okay. Can colleagues see that?
Yes, we can.
Yes.
Yeah, brilliant.
Yep.
Okay. Right. Okay. So just by way of introduction, we have, from a Council of Disabled Children perspective, been talking about data and outcomes for quite a while, actually, now. And it started in actually about 2017 when we developed a national logic module for looking at improving outcomes for children and young people with special educational needs and their families. And that led into looking at using actually Mark Friedman's results-based accountability model, actually looking at a data set that we could form into an Excel dashboard, which is actually on the CDC website at the moment. But we certainly, when we were working with colleagues in the Devon Devon STP area, and also other colleagues from around the country, we actually wanted to kind of take the data a bit further forward in terms of visualization of that data, which is kind of why we're now kind of moving into a Power BI dashboard. But the whole emphasis was from the outset was to look at how we can establish a single source of the truth, which brought kind of local data sets together with a national set of data. So the dashboard, which I will be sharing with you in a few moments, is talking about how we've been able to collate a range of different national data sets together. It also provides links to other national dashboards that are already there. So in a sense, it does kind of fit in with that single source to the truth approach. And we're also really keen that anything that we develop at kind of CDC level can be shared at a local level. So we're wanting, and that has been the experience of colleagues with the Excel dashboard. They've been able to look at that and then actually download it and include that within their local data reporting kind of system. So it brings in that local data set alongside the national kind of data sets. And that's very much kind of where we are with Power BI. That was the recommendation that came from colleagues in Devon and elsewhere, that we actually kind of developed something that could be kind of downloaded from the CDC website and used at a local level, and also to kind of feed in that kind of local data set into that dashboard. But we also were really mindful that we wanted to, I suppose, take the dashboard to the next level, and that was about measuring impact. So we did a piece of work probably about 18 months ago now, where we worked with colleagues from across the country, bringing parent care forums and commissioners, clinicians together to actually kind of think about, if we were thinking about what good looks like, what would be those outcome statements that we'd want to be talking about. And this is in a sense also kind of recognising that many local areas already have their own outcomes frameworks for either children or children with special educational needs and disabilities. And it was thinking about how we kind of brought all that together. So you can see here on the slide, we've got in a sense, the kind of collated list of outcome statements that were kind of co-designed by the Data and Information Sharing Accelerated Working Group that the CDC kind of hosted. And the key question was then, well, how do we actually measure that impact? And I've just given you a kind of a selection of some of those indicators here that we've showed. Actually, we've probably got about 4 indicators for each of those outcome statements. One of the key things that we recognise was that in many respects, the tools that we have locally or indeed at a national level to kind of collate this data may not necessarily be available. But certainly one of the things that the colleagues from the data and information sharing kind of working group was saying was that if we were able to kind of develop, for instance, standardised questionnaires that could be used as part of an annual review process within the education, health and care plan, or indeed SEN support kind of review processes, that would actually kind of capture quite a lot of the information that we need. So there is work going on at the moment to look at working with local areas to kind of develop a questionnaire template, for instance, that could be used, you know, much wider across the country. And also we were kind of recognising that, you know, when you get to this kind of level where you're actually wanting to kind of measure impact, we want to be able to kind of make sure that that we're capturing kind of data sets from a whole range of different sources. And one of the things that we were talking about with colleagues, I think it was in the Northeast, was that when we're talking about kind of I feel safe, some of that information may already be being collected in terms of surveys for kind of children and young people, for instance, who are experiencing bullying. And it was then sort of taking it into the next level and actually making sure that there was a kind of an SEND kind of slant to some of those more standard questions that were being asked. And again, thinking about, you know, that whole kind of question around employment and access to, you know, support, which kind of leads to independence. We recognised again that was a kind of a key area that we needed to focus on. And we've also been able to kind of engage with colleagues just to kind of think about, OK, we had the dashboard for the Excel dashboard, but what additional information do we need to include in the Power BI version? So you can see here that we've actually been able to include a number of different kind of indicators in the dashboard, which I'll be able to kind of show you in a minute. And we're working on actually looking at the community services data set, so we are hopefully going to get on there next week. But actually, for me, one of the interesting things which the dashboard tells in terms of a story is actually some of the questions that we know that local areas are asking, in the sense as a team we wanted to answer, aren't actually available in terms of the national data sets that are being published. And one of my reflections actually from this morning's presentation is actually something that I've been encouraging colleagues within the East London Health and Care Partnership to kind of think about in terms of Mark Friedman's results-based accountability model, and thinking about developing outcome frameworks, which is something which colleagues are starting to kind of think about there, is around a turning the curve exercise. And that's something that, that from the vaccine programme perspective, which is kind of one of the things I've been doing more recently, is to have a series of turning the curve exercises where we actually look at inequality and inequity of access to the vaccine programme. But that could be something that we could use in terms of the next step, because the next step for me in the dashboard, and something that our colleagues at CDC are very keen on, is to look at how we can use the dashboard to start to kind of capture some of that data which measures impact. And one of the things that we might want to have a conversation about are what are some of those national indicators that we want to include in the dashboard, which help us to look at turning the curve, that turning the curve question, you know, at a kind of a local, regional, or indeed a national kind of level. So I'm just going to pause there, and then I'll just kind of unshare my screen, and then I will show the dashboard, and then we've got we can come back to this and look at the discussion questions. So I'm just going to. Right. Can colleagues now see the dashboard?
I can see the PowerPoint presentation, but not.
I can see the PowerPoint presentation. Okay, apologies for that. Right, so let's go back.
I think you'll need to unshare from Teams.
Yes, no, that's fine. I can do that. Right, stop sharing. Okay, and now reshare. Can I see that? See the dashboard, or can you just still see my presentation slides?
Can just see you.
Yeah.
You can see me. Oh, okay.
Yeah. Concentrating very well.
Right. Okay. Well, I'm just trying to get it to appear on my set of slides. Right. Ah, it has now come up.
Now
okay. Can everyone see that?
Yes, thank you.
Right, brilliant. Apologies for that. So I just want to kind of take us back to the start. So what we want to try and do here is create an interactive dashboard which has far more kind of visualizations kind of within that to help to tell the story. And with a Power BI dashboard, obviously you can kind of print off a whole series of reports which you can put into PowerPoint slide decks, or indeed kind of Word documents. And we have given colleagues a kind of a how-to guide on using the dashboard, and it will actually help for people like me who are quite new to kind of using Power BI, right through to those who are, you know, very much kind of familiar with data analytics and looking at more the kind of the back end side of the dashboard. To be able to kind of include this within any local dashboard that colleagues have got in place already. So we've got in here the population outcome statements that we were referring to previously. So at the moment, it just has all of the indicators that we have recommended through the work we did across the country in terms of identifying some of those indicators linked to those different outcome statements. And again, there's conversations going on really around actually, so how do we measure that? And at the moment, we're thinking that the only way of doing that is really at a kind of a local level, but I think it will be really interesting to think about what are some of those indicators that we could look at, for instance, through a turning the curve exercise. And then you've got in here access to all of the different external dashboards, because we don't want to kind of reinvent the wheel if there's things that are already out there. So you've got all the links to those. And then we kind of then move on to thinking about some of the data that is publicly available. And I think one of the things that came up from the AWG was actually thinking about the looking at this from a demographic perspective. And at the moment, the data is only at a national level. So this is what we were saying about telling the story. I think it would be really helpful to be able to kind of have this at a local authority level, for instance. But as you can see, it gives you a kind of a helpful kind of snapshot. And you can go up here and then, for instance, select the special school kind of data, and it will then be able to kind of pull the latest kind of information together. Obviously, this is something that we'll need to keep an eye on in terms of when data is published, so that we can think about kind of keeping this as up to date as possible. You note here that the data is as at January 2019, so we'll just need to kind of keep an eye on when new data is published. And this has been a slide which, when colleagues have seen this in the past, has been sort of quite helpful for colleagues. So what we can do here in terms of looking at the numbers of pupils that attend different schools, we can go in. You've got East Midlands up here, and we can actually look, drill down into a particular area. If you press Control and click on the different button squares here, we can start to pull up that information either for a specific kind of local authority kind of area, or looking at it right across the region. And then here we go, we've got Leicester, and if we press Control and on the next one, we can then have we can compare Leicester with Lincolnshire, and it kind of changes all of the data that we have there available. And as we kind of go through, we've got a range of different tabs looking at kind of need type. So we've got this in terms of primary need type. So again, this is looking at, in a sense, kind of the whole country. But you can kind of drill that down into a particular region or a particular local area. And for me, the visual is really quite striking. Really quite, apologies, my phone there, really quite striking in terms of actually just thinking about how the numbers, and you can actually go on and it will tell you the exact kind of numbers kind of within that. And if you go forward in terms of local population, again, we've got this at a kind of a borough level, or indeed at a kind of local an SDP or C2G kind of population level. So again, this is just thinking a bit about kind of that, some of the telling the story from a local perspective, and we've got different indicators here around education, health and care plans, personal health budget, contact and mental health services, etc. So this is a bringing together actually some of the data that you'll see in other tabs into one page. And then we continue to kind of work through in terms of thinking about some of the kind of the early years data. And again, so we've got it here at the moment about just focusing on Hackney, but we can include some of the other boroughs in London, for instance, kind of around that. And so you can again kind of drill down into that. And we've got similar things. We've got similar things around Key Stage 2, Key Stage 3, and NEET, which I won't go into at the moment. But we've also then got some information here around the SEND kind of profile by those who are not in education, training, and employment. And again, you've got that kind of visualization looking at that across the different kind of regions, or indeed being able to drill down into a particular local authority kind of level there. One of the things that we were keen to do in terms of thinking about the learning disability kind of data was, and we've broken this down into two sections. We've got the kind of learning disability kind of data there that's from the National kind of Learning Disability Statistics. So again, we've got some of that information at a kind of a national level, as well as at a Transforming Care Partnership kind of level here. But we also have been able to include in here the learning disability health check data. And I think for me, this is going to be an interesting one when we're thinking about the vaccine programme, the recent announcement this week, where we can now expand the vaccine programme to include all people with a learning disability over the age of 16 and above, because hopefully we'll then be able to look at how we can improve the number of people with learning disability coming in and being registered within their GP on the learning disability register, and then getting access to the health check. So we should hopefully see quite a big improvement in the number of people being with learning disability being known to a GP. And then we've also got kind of information in here around absence and inclusions. And again, I think at the moment this is at the information that we've got available is at a national level, but again, this is something that we could potentially look at a local level. And then finally, we've also got some information in here around the finance kind of information. And again, one of the conversations I'll be having with colleagues at CDC is just making sure that we've got the most up-to-date information here from the DFE on the finance sort of side of things. So I'm going to unshare my screen now. And I want us to go back to the discussion questions that we have. Oops. I just need to close that down. Okay, I think what we'll do is we'll just go, I'll stop sharing my screen.
I can share.
Okay, that would be great if you wouldn't mind doing that. Let's see. So just thinking about what we've just been kind of looking at and hearing about. What do you think are the opportunities that we have to kind of use a dashboard such as the one that we've been developing at Council Disabled Children with, you know, the work that you're doing at a local level? Will you find the kind of the data sets that we've been sort of pulling together helpful in terms of thinking about? It's the final slide, Daphne. That's it.
Hi Martin, it's Vicky Monkmeyer here from Waltham Forest. Is that all right if I just chip in?
Yeah, of course, go for it. Yeah.
I suppose one of the things that jumps out is that there's very few national data sets around health that apply for children. And some of them, I mean, having locally had to write sort of reports to board around sort of national tracking of things. One of the things that could be reported is simple things like numbers of children known under continuing health care, those having a care education treatment review, numbers on your dynamic risk registers. So we've got some sort of, it's difficult to sometimes get a national comparison on those because obviously services are very differently arranged in each area, and that sometimes does affect some of the numbers, but those are particular thresholds for services where you probably would be able to have a comparator, and it gives you an understanding sometimes about where services are doing a lot to try and develop service. So if their numbers are particularly low, you might want to know why that was. If they've got particularly good services, that means that they're able to intervene in a different way, and it sort of pulls out good practice in that way. It also helps you if you think, oh, I didn't realise I was struggling, and then you find that you are when you look at other people's numbers and realise, wow, mine are higher than yours. I needed to really do some work on this. I think, but it is very striking that we don't really ask much about children, and from a health perspective on those national programmes, given the SEND programme, it has a huge reliance on health delivery. You know, around therapies, children with complex needs, etc., which tends to go a little bit hidden, I suspect, because it's quite difficult to pull out the indicators, probably.
Yes, I mean, certainly, I mean, very happy to circulate the original scoping document that we did, which actually looked at the indicators that we could pull out at a national level and a local level. And you're absolutely right. It would be helpful to look at that, some of those data sets at a national level, but because at the moment you could only kind of really kind of see them at a local level, or indeed at a kind of an ICS level, for instance. And so, yes, I agree. I think there's real opportunities there. Any other thoughts? Robert.
I'm just agreeing totally with what Vicky's just said. I always find these meetings, when we look at databases all around education, and even less about health, but social care equally. One of the things which I just wonder whether there's an opportunity is when you look at the things like, is it safe for a child? One of the markers which we would look from a physical, from a paediatric point of view, it would be, for example, have children, all children with epilepsy, for example, got healthcare plans, epilepsy healthcare plans in their school, for example, because they would feel safe if they had that, or even asthma, for example, or diabetes. Have they all got healthcare plans? You should all have, of course. But we can almost use it as to start thinking about healthcare parameters. I don't think we think imaginatively about it. We just look at overall data in a sense. But for the individual child, that might not mean anything, of course. So I think there's an opportunity now for us to really start looking at health data more imaginatively, to be honest.
Yeah, no, absolutely, and I think that's one of why we wanted to kind of move to a more of an outcome-based approach, recognizing that we need a kind of a mixed kind of data set of output and outcome kind of data sets, you know, within any kind of dashboard, so that you can kind of tell that story and look at potentially the kind of impact kind of around that. Yeah, so absolutely, I think that's really welcome. Anyone else? Oh, sorry, I'm aware that someone else got their hand up and I can't see who that is.
I think there's a few of us. It's Sam here, Sam Bahran. Sorry, just jumping to the top of the queue there.
No, go for it.
So we worked with the Council for Disabled Children, and was it the council? It was Barry Jones and Pat Bullen. Anyway, we worked within Northumberland to carry out a performance-based accountability approach to generating some outcomes. We ended up with a set of 13 indicators. However, and they were co-produced with parents and carers, with education, health and social care colleagues, which in itself was a very strong exercise. However, that indicator that you had around the percentage of children and young people who report that they're happy, there is something about what is it telling us. So say we get 76%, that good? Are we happy that 26%, whatever, are not happy? Can we count on it? And I know that you would use it as an example of carrying out, you know, a turning the curve exercise. You'd actually then go, let's have a look at that indicator and we'll work around what is it actually telling us. We'll get a load of people in the room, from parents and carers, young people, and people across with the system to explore that. But it didn't really tick the box in terms of we were being asked for, but how do you know that things are getting better? And so we've kind of drifted for a little bit away from that now, in that we are now looking at, we've just had a recent SEND peer review, and one of the comments that we got was that you've got a lot of data. We've gone out and we've mined it from every single nook and cranny, but they said, what's it actually telling you? And I think there's a danger about collecting a lot of data, but actually what does it inform you about the outcomes and the needs of children and young people in your locality is quite problematic. And so for us, we are now concentrating on the annual review form in terms of being a mechanism by which we can capture it. with the voice from young people particularly. And I think we've also got one indicator which is going to be on the annual review form, which is asking parents and carers, how confident do you feel that you're about your child's coming year? If we get a high indicator on that one, then we'll know that everything else is lined up. So we were looking for the bellwethers, if you like, of outcome statements. And same for the child or young person. So I think it's really, really fraught, and I love the work that has been done around this. But I find myself increasingly looking to local outcome measures, which are in Health Speak proms, directly reported from children and young people, because those are the things that when you're inspected, well, those are the things, first of all, that if you get right, then you don't, then you know you're doing it right. But when you get inspected, that's what they ask you for, and that's often what we don't have. What we have is a lot of national data sets, and it's actually, I think that as an area we probably focus too much on the data sets and not enough on getting the voice of children and young people and their families. Sorry, that was a rather long comment. It wasn't a question, really.
Yeah, no, that's very helpful, and I think that's all part of the learning journey that we're on, isn't it? And I think it absolutely has to be kind of local data as the kind of the primary driver, and then looking at how we can bring that bring national kind of data sets into kind of, in a sense, enhance and tell that story. When you think, for instance, wanting to kind of compare with other areas, for instance, that are, you know, statistically kind of similar to you. So I think you're right. I think it's got to be a mixture of that. And yeah, I mean, really interested in the work you're doing around the annual review, because that's very much kind of where we were thinking of, in terms of you've got such kind of rich source of opportunity there to kind of really understand the confidence levels of child, young person, family in the system being able to support that individual needs going forward.
I think one comment to that is that we're worried about our SEN support population, because that's the voice that you don't often hear, whereas the EHC plan learners have got a process. They've actually been assessed for help and have help. So we're now considering what we can do around the SEN support learners.
Yeah, absolutely. Yeah, it's got to be both. Yeah, we've got to be both kind of around that. Any final comments by colleagues? Sorry, we haven't been able to.
Yeah, we do have a minute left. I wouldn't want to take away your coffee tea break, so maybe we can wrap it up with one last comment.
Can I just hello Martin, Karen McGowan here. Just to say very quickly, we've in Staffordshire CCGs, our local authority colleagues for some time have said to us, please can you share the data you get, which will complement what we get. And you're absolutely right. In CCG land, you know, we get the indicators into the contracts, and the data simply supports the conversation that then follows. So the plan is to get some KPIs into the contract, agreed with the provider. Then when we have a monthly meeting, we'll invite our local authority colleagues in, and that prompts the discussion that we have. And we're trying to do that and have been for a while now. But I would be really keen, if anyone's got any data sets out there they could share with us. I mean, in the ideal world, nationally something could come out that we could just nicely drop into our contracts. But if anybody's got anything, but like's been said previously, the data sets are only the start of the conversation. They give us the starting point to then build on, put the challenge, have the discussion and understand the system. But there's some really, you know, health can do that. There's a lot of KPIs that we can get from the provider if we work with them.
Yes, I would agree with you. And just on that, is when we do the kind of that outcome-based accountability approach and the outcomes framework, there may well be an indicator that can go across multiple contracts, whether that's from in a health, education, or indeed a social care context. So we have the same indicator going through, you know, all three, in a sense, kind of agencies, commissioning kind of processes. So again, that's for me one of the things. And thinking about actually, as previously been discussed, you know, what are those kind of really key nugget indicators that really help to tell a story at that kind of high level? And if you hit that one, then you're going to hit a number of other indicators underneath that. I think that's been one of the discussion points that we've been having as we've been going around the country on that. Okay, please. It's now just gone 20 past 12. So thank you very much for coming along to this particular workshop. We'll share the slides with colleagues, and we'll also keep you in posted about when we'll be able to kind of post the dashboard on the website. That won't be that long now. And if anyone's got any kind of thoughts about how we can improve the dashboard, or indeed thinking about some of those other data sets that we can include in there, then please feel free to contact us.
Thank you, Martin, for the very useful workshop.
Thank you.
Thank you.
The next workshop is at 12:30, so you can click on the second link you received. And if you're not joining it, please fill out the evaluation form now. Thank you.